It can happen any time of the year, but summer is the main time to watch out for ticks if you are outdoors. It's also the most prevalent time of the year to develop Lyme disease.
Yeah, Dr. Brandon Bentley joins us again. He's with the Department of Family and Community Medicine with Wellstar MCG Health. And today we're discussing what Lyme disease is and how you can protect yourself from getting it.
Hey, I appreciate it. Thanks for joining us here
Good morning to you both.
Awesome. Well, can you talk to us a little bit about what Lyme disease is?
Yeah, so Lyme disease is actually a bacterial illness that is carried by ticks. So this is primarily coming out in the summer when ticks are going out and they're starting to bite people. It is carried and transmitted by tick bites rather than just a tick crawling on you. So it's something that you have to think about when you're bit, not just if you see them.
Okay, so bites is how this is transmitted.
Correct.
Okay. What are some of the signs if you're looking at somebody who, or you think you might have Lyme disease, contracted it?
Yeah, so if you develop fevers, headaches, there's a typical rash. It's like a targetoid lesion, so it actually looks like a target after the bite. Those are the typical signs that we look for after a tick bite. It's also carried by a specific type of tick. It's a black-legged tick. They're not super prevalent within the state of Georgia, but they do exist here. It's primarily found in the Northeast and the Midwest. So if you're doing any traveling or hiking in the Appalachian Trail, you certainly have to think about these types of ticks. And like I said, it is found in Georgia. So this is not specifically if you're traveling. It can happen here.
I mean, it's kind of scary. I've had a tick on me before and just been looking for that little red line. Like, it's supposed to be a circle around it, right? If you possibly have
and the good news is, right at the time of the tick bite is usually okay. So if you get that tick off immediately, most of the times you don't have to worry about any particular disease. It's if it's been latched on for some time.
Let's talk about that because there are so many different old wives' tales about how to get rid of it, how to remove it. You want to just try to like twist it off. Is there a better way of removing a tick?
Usually you want to grab tweezers close to the skin towards the tick's face and then pull and pluck from there. Please don't grab a lighter to try to burn it off. More people will end up causing burns to their skin. So yeah, tweezers right at the base and pull from there.
Okay, great.
How can you prevent a tick from biting you in the first place? Is there actually a surefire way to make sure you don't get bit by them?
Nothing is ever 100% certain. So if you're going to be outdoors, there's a chance you could get bit. And it's a good idea that if you're going to go on a hike or spend some time out in the yard, that you do a once over of your skin just in case. But tucking your pants into your socks if you're going to go on a hike, wearing good hiking boots that aren't going to have holes in them, wearing long sleeves that have some elastic at the wrist to prevent anything from going up into the sleeves. And then actually if you take some duct tape and you tape around where the socks and the shoes are, if you do them inside out, the ticks will get stuck on their crawl up your pant leg, and that helps prevent some of the ticks from getting onto you.
The more you know. There you go.
So every time you go out in the wilderness, you need to do that?
If I was to go out on a hike, that's something that I'm going to do because I'd prefer not to get bit by ticks.
Yeah, me too.
Exactly.
All
right. And actually, you might have seen some of Brandon's dogs here running around as well. Dogs obviously can get ticks as well. Is Lyme disease only for humans?
So Lyme disease, primarily, we are concerned about humans, but it's not exclusive to humans. If we notice ticks on our dogs, we should call our vets because they can carry a host of multiple illnesses. So if we notice that there's a tick on our dogs, we should make sure to get in touch with our veterinarians. It's a lot harder to find them on them. They don't complain as much as we do, and it gets easily lost within their fur, so it's hard to find.
Gotcha. Can we talk a little bit about the diagnosis and about treatment for Lyme? What does that look like?
Yeah, so if you think that you've been bit by a tick or you notice that you have been bit by a tick, you certainly see it. Take that tick off. You don't need to bring the tick into the doctor's office. That is not necessary. Most places don't need to run any sort of testing on the tick to see if they carry illnesses.
Good to know.
If you found that you did not have a tick there, you went outside, now there's a tick, you can take it off. Most people do not need any sort of antibiotics if it's just been from a quick time of the tick bite. The transmission of the illness takes a little bit of time. So most of the time, if you don't know when you were bit and you happen to look down, you find something, maybe it's tucked over behind a knee or if it's between a toe and you just didn't notice it, which is not uncommon. then go ask your doctor, find out if this is something, if you've been into an area such as the Northeast or the Midwest. It's called Lyme disease because the first place it was discovered was Lyme, Connecticut. So it's Lyme. Pretty common misconception. So if you've been in those areas, it's actually reasonable to just go ahead and get treatment. So find your physician. It's an antibiotic, and if you've been bit up in those regions, go for it. It's worthwhile to get checked out, talk to a physician, see if you're at risk. And there are certain populations that are more at risk than others, and they need some empiric treatment as well.
Stay vigilant out there and keep an eye out for those ticks too, and you can prevent Lyme disease from happening to you. Dr. Brandon Bentley, appreciate it. Thanks for joining us.
Thank you.
Thanks for having me here.